system. So if health is a devolved function, and today you are saying you would wish to have a reversal of the constitution, where it goes back to the national government, whom do we blame? Is it the people, the governors? Because from what you're saying, you're even appreciating, the front page of the Daily Nation is talking about 1.2 billion being lost, courtesy of the same CS Health you're saying you're grateful for. Perhaps he's done some good things that we have not seen or heard
of. The UHC. Fine. Particularly the UHC.
So, whom does the buck stop with when it comes to management of our health system in this country called Kenya?
First of all, our constitution envisages a two-tier management of healthcare in this country. The national government has a responsibility on the national referral hospitals and also on the regulation plus setting standards.
How is that going according to you?
Let me just contextualize a bit.
Okay.
Then the counties have also their bit on the issue to do with human resource management and also the facilities that those county facilities, the level 1 and 2 facilities, that's the hub and spoke, the level 1 and 2 facilities. The counties have a responsibility to be able to conduct the primary health care facilities and be able to do that. The national has got its own bit. Now, this is a situation where we, every day the national government actually gives money to counties by the way of the constitution. There's that shareable revenue,
yes,
that the counties are supposed to get money from the national government to be able to do their activities, because resources must follow functions in that context.
Correct.
So if we are seeing our governors not doing their bit, there's no money for anybody here. Monies follow budgets. Budget. Like for example, right now we have a fiscal. There's a budget process.
Yeah.
Everybody is expected to give the estimates to the national, to whoever, and ensure that these estimates, this budget, actually is funded by the national government or the county government. What we are seeing is a situation of supremacy battles between the two levels of government, and that's why we are saying the same way we have education and security domiciled at the national government, you don't see problems with them. We also want health to be domiciled at the national government so that we can be able to have an easy ride, a smooth ride in the implementation of healthcare services. Remember, Article 431 talks about the right to healthcare, and it actually singles out all the services, be it curative, be it preventive, be it palliative care, all the healthcare services being the right as a right of Kenyans. When we deny them, cases of us going on a strike because of an issue that is actually very simple. Like when you sign a CBA, for example, then we sit.
So who signed the CBA?
The CBA is signed by between the employer and the union.
And the employer is the county.
In this aspect, the employers, we have we have 48 not governments.
Yes.
The 47 plus the national one, where now all of them sit together at a central place and then sign a CBA. So therefore, it is their prerogative to be able to implement the CBA.
So before you take the industrial action,
before
you take the industrial action of going to the streets,
yes, sir.
And well, rightly so, because you are fighting for your rights, but patients will be abandoned in one way or the other.
Correct.
Have you sought audience with the 48 organs of employment?
The Labour Relations Act is very clear.
Yes.
There's a procedure to issue a strike or even a lockout. If you have to go on a strike as an employee or as a worker, you give, first of all, a demand notice.
Which
we did.
Okay.
We gave a 21 days demand notice. Later on, the demand notice was not honored. We later came and gave now a 14 days strike notice, highlighting the issues that I'm actually discussing them here. The same 14 days elapsed. The national government, the county, did not invite us for a meeting. For example, and in our notices, we've always said, we remain available for amicable resolution. The employer has not invited the trade union, the other union need us in a meeting. How do we expect us to speak? We don't speak with the walls or tables. We expect that, being a serious government, they will actually see the sense of inviting the union leaders for a meeting, broker a truce or rather broker a stalemate because of the issues. Let the Minister of Labour is silent. The Minister of Health is silent. The Council of Governors are trading blame games to each other. Where do we actually go? And here we are saying these issues need to be sorted. Now, we cannot be able to talk when we have not been invited on a table. We are saying even right now, even if they were to call us right now, we are willing to go and sit down, agree on the issue, and not just agreeing. We need to agree and have an implementation of framework on what we're actually agreeing. Remember, doctors went on a strike on a 2017 CBA. That was actually signed and not implemented. We have a tendency in this country, we have a tendency in this country of signing documents, then we don't